Hello everyone, it's Dr. Gupta at the Dermatology Laser and Vein Center, and today we're going to walk you through a procedure called photodynamic therapy. So photodynamic therapy is a procedure that is done using aminolevulinic acid. This is a photosensitizer that we apply to the skin, and it helps to actually target the sebaceous follicles under the skin. So first what we do is we prep the skin using acetone, and that just takes off all the oils and grease and dead skin cells. That's what we just did. And now we're applying the levulinic acid. So this is also absorbed by precancerous cells, such as those found in actinic keratoses and potentially in early basal cell skin cancers and so on as well. So it is also a useful treatment in patients who have a lot of sun damage on their skin and are at risk of skin cancers and have a lot of actinic keratosis. In this case, our patient has acne that has been very persistent and somewhat resistant to a lot of different therapies, including oral and topical agents. And so we want to give this photodynamic therapy a try to see if we can permanently shrink those sebaceous glands under the skin and help her get a long-term clearance of her acne. So after applying the levulinic acid, now we're applying gel to the skin because I'm going to do another laser treatment first. And this is the BBL acne laser treatment. There are different filters we can use. In this case, we are targeting the sebaceous follicles, and also this particular light will activate the levulinic acid as well, but it will also help to target some of the bacteria and some of the persistent red areas that have developed on our skin. So we're starting to also treat some of the scarring as we're doing this procedure. And you can see it's a fairly bright light. I make several passes over the skin. Again, the idea is to activate the levulinic acid, which has now been absorbed into the sebaceous follicles. In the case of precancerous lesions, the levulinic acid gets absorbed by the precancerous actively dividing cells. And then it gets activated and causes a photodestruction of the sebaceous glands or the precancerous skin lesions. We usually like to let the levulinic acid sit for at least an hour and perhaps longer if we're treating other body areas where the absorption might take a little bit longer to get into those deeper layers of the skin. This is the blue light that we're using afterwards. We can also use a red light if we want to get more aggressive, but the blue light helps to kill bacteria and can even be a standalone treatment in acne. But in this case, we're primarily using it to further activate the levulinic acid. Afterwards, the patient will make sure to avoid sun exposure and daylight exposure for 48 hours, as that levulinic acid can be active for that period of time. Thank you so much for watching.